In this video, we're going to discuss some of the top perimenopausal and menopausal symptoms out there. And so hopefully learning about these, knowing that this is a potential symptoms, helps someone feel not alone out there and know that there can be hopefully something done to make these symptoms better. This is a New School OBGYN. My name is Eric Schmidt. I'm a board certified OBGYN. And in this video series, we're talking about menopause and everything around it. And so stay tuned. Unfortunately, with all of these hormonal shifts and changes that can happen during menopause, there's an extensive list of potential symptoms and probably symptoms which we haven't even discovered yet that can be attributed to menopause. And so it might help to leave a comment below saying, this is what I experienced during menopause. Maybe somebody can see that, relate to it, and not feel alone out there. So feel free to do that. So as we discussed in the previous video, the hallmark of menopause and the definition, the very narrow viewed definition, is the abnormal menstrual changes that can happen with the menopause and perimenopausal time. We might term this abnormal uterine bleeding. That's our term that we would use as a clinician. I would actually say that about 70% of my new patient visits and consults are about this abnormal bleeding that can happen in this perimenopausal time. Now, those shifts in bleeding can be, change in duration. Some might be shorter, some might be longer. A patient might experience a nice short cycle and be like, okay, that was great. But then it comes back in a few months and is twice as long, twice as heavy, bleeding for a month. These things can be severely disrupted and need to be evaluated. So please try not to brush off these symptoms of the abnormal bleeding and just say, it's perimenopause. It's what, someone has to go through. I hear that too often. Someone just puts up with something and says, this is, again, not my words, but saying, this is just something a woman goes through. No, we want to see you. We want to evaluate you and help you and hopefully make this perimenopause, menopause transition easier in every regard, but especially with this bleeding. And it's always important to rule out any other causes of this abnormal bleeding, whether that's things like fibroids or polyps, all those other things can cause abnormal bleeding. And in certain people with risk factors, we might want to evaluate for even things like precancers or cancers in this perimenopause, menopausal time if there's bleeding irregularities. And if we kind of explore the, why this is happening, why is this irregular bleeding happening with perimenopause, that's the diagnosis, it's called anovulation. And so the brain is communicating to the ovaries, and eventually the ovaries don't have the supply of eggs, and the ovulation is inconsistent, and so someone might miss an ovulation cycle, which the normal transition of the hormones and the progesterone rise that leads to and drop that leads to someone's menses doesn't happen, and so it's just more of an estrogen signal to the uterus, and this often can destabilize that area, and the bleeding can be significantly disruptive for some people going through this perimenopausal time. One of the next most common symptoms would be the night sweats, the feeling of flushing that can happen in this perimenopausal time, and this is actually one of the most common symptoms. We term it, vasomotor symptoms, and so this is really where that flushing, it comes from the chest and it spreads to the body, and there's this intense feeling of warm, and you have to toss off all the clothes, put a fan on, get a cold rag on the head, because of this feeling of this flushing can be severely disruptive, and especially if this is happening at night. We term it night sweats. Makes sense. And so, this can be severely disruptive to things like sleep. Yeah, we love sleep. We get off our sleep patterns, and it can severely disrupt us the next day. Listen to all these podcasts and everything talking about how important sleep is. Well, if you're up multiple times per night, having to toss all the covers off and, fans and everything, and then all of a sudden the next few minutes you're so cold, you're not going to sleep well. And so this can lead to a cascade of other things, mood changes, things like that. And so this is one of the most common symptoms that someone gets going through perimenopause. Approximately 80% of women will experience these, we call vasomotor symptoms, through their perimenopausal and menopausal times. And during these hot flashes, someone can feel like they have palpitations or their heart's beating out of their chest, severe anxiety, and so it just further shows that this can be significantly disruptive. Again, we shouldn't be shrugging this off. It's just hot flashes. If this is interrupting somebody's relationships, or interrupting their work, their ability to do the certain things that make them happy on a regular basis, we should be evaluating this and potentially talking about treatment option if that person desires. But please don't shrug it off as just something that someone has to put up with because it's perimenopause. One of the things that is starting to get some attention out there and attributed to the perimenopause, menopausal changes. I think a lot of women know that these metabolic changes happen during this time, but it hasn't been too long where clinicians are recognizing it and recommending treatment or giving the patient the tools they need to combat the body weight changes or body composition changes is a better word, that come with the perimenopause or menopausal time. And what I mean by the body composition changes is there's an increase in the visceral fat of the body, meaning the fat around the organs. Less concerned about the subcutaneous fat, which is more of like cosmetic fat, but this fat around the organs increases somebody's risk for cardiovascular disease, type 2 diabetes, arthritis, cancers, certain cancers, and actually increases their mortality or potential death rate. And it's much harder to lose this type of fat. And so hopefully, a lot of our future treatments can be directed at prevention of this and other treatment options. Next thing we'll talk about is the genitourinary changes that can come with perimenopause or menopause. With decreased estrogen to the genitourinary area, meaning like the vaginal tissues, the urethra, the bladder, the uterus, someone has decreased estrogen will have less lubrication, they'll have less collagen integrity, they'll have less blood flow to the area, and potentially the microbiome won't be as healthy to protect that area from certain infections or microabrasions or things like that. And so as you imagine, that person might have more irritation, sometimes described as an itching. Sometimes there might be a discharge, painful sex, prolapse, potentially increased risk. Again, that collagen support loves estrogen. And so this is, again, a big category of changes that happen with the menopausal transition. Going along with that, the next symptom would be sexual dysfunction. And so this is one of the most under-evaluated, under-treated by general practitioners and ourselves as OBGYNs. And so we need to do better to explore potential treatment options for things like hypoactive sexual disorder, or someone's not wanting to have sex, or someone has a difficulty with arousal, or someone has pain or failure to reach orgasm. These are all potential perimenopausal, menopausal changes that can happen, and diagnosing the right one helps someone to get the right treatment, which hopefully improves somebody's relationships and lifestyle, and we can all be happier. The next one is a big one, and this is the mood changes that can happen around the perimenopausal time. So there can be a significant increase in things like depression in this perimenopausal or menopausal age group, with a significant fluctuation in hormones, and then eventual decrease in hormones and things like estrogen. So yeah, increase in things like anxiety, depression, and or that it worsens during this time if somebody previously had been diagnosed with it before. And again, I don't want to ever understate these symptoms, especially the anxiety and depression that can come with these changes. Sometimes paranoia, sometimes OCD type behaviors can develop during this time, and it's because of those sex hormone changes that perimenopause and menopause. Again, there could be potential easy treatment options for this. Next, brain fog or memory impairment. This is one that we commonly hear around this time. And don't feel alone out there if you're feeling this brain fog or memory impairment during the perimenopause or menopausal time. And again, this one I think is often way too, brushed aside by clinicians. And so, yeah, we should be starting to, again, evaluate and treat if someone's experiencing these symptoms, if they want it, because it can severely impact relationships and daily life work with these brain fog moments. And kind of getting to the end of the list we'll talk about today, but there can be significant changes to the skin. It's definitely out there where people get more itchiness of the skin. You have, again, a loss of collagen that likes that estrogen, and so that can cause some of that, the thinning of the tissue, and people can suffer from some pretty debilitating itching during this time. Also, hair loss, or what we call androgenic alopecia, is the decreased estrogen. Now we have more predominance of the androgens like testosterone, and so sometimes there can be that that you're kind of losing the hair you want. Sometimes you're gaining some hair in the places you don't want. Again, these are all changes with potential treatment options that someone might experience through menopause. And there are so many other symptoms out there and so many other that yet to have to be associated with menopause. And so, again, leave a comment below if you're experiencing something that you want someone else to not feel alone out there if they're experiencing it, because that's my hope, is that talking about these symptoms can validate somebody, and don't feel alone, and don't feel like they're being brushed off by providers, because we do care. We want to help you through this. And so we need to acknowledge, offer treatments if desired more often for these type of symptoms as somebody's going through their perimenopause and menopausal time. I hope this video helped out. We'll be talking more about menopause here in the upcoming videos, so stay tuned for those.